Just last week, we had a mom and dad bring their 5-week-old son in to see us. He had been diagnosed with congenital muscular torticollis, and mom and dad were worried. They wondered, why does he have this? What does this mean for his future? They were a little disheartened when the PT told them, we're going to schedule 6 months of appointments, and it likely is going to take that long for things to really clear out. And they were also confused because they noticed if they would do the stretches and the exercises that were recommended, this little lump on baby's neck, it would go away, but an hour or two later, it would come right back. They even noticed if they would push a little bit far, baby's face would actually turn blue, and they started to wonder, are we doing more harm than good? What's going on here? So step one, I was able to share with them, why does this happen? And in our office, we may see things like a stressful pregnancy where baby is stuck in a certain position the whole time. In this case, this little boy, his head was stuck up under mom's rib cage. The most common thing, however, that we see is a stressful labor and delivery. Maybe it is C-section, forceps, vacuum, having to be pulled, twisted out a certain way. It could be a stalled labor. Again, in this case, mom actually didn't know that baby was breech, so they had to do an emergency C-section. The other challenge that we see then is they are wondering, why is it going to take so long? And often the traditional look and approach to something like torticollis is focusing all on the muscle. The muscle's tight, so let's stretch it to make it loose. But why does it tighten up again right away? And how we approach things differently in our office is to look at torticollis as actually a neurological problem. You see, this stressful labor delivery being brought into the world is actually commonly something that can impact the brainstem, because that is the upper part of the neck, the upper part of the spine actually guards the brainstem, and if there's birth trauma there, it can affect the nerves leaving that area. Number one is the vagus nerve, which brings calm and relaxation into the body. You might notice your baby is also colicky or refluxy or tense, that they don't relax the way you expect them to as a newborn. In this mom's case, they actually noticed baby was sleeping way more than they expected because his system was just under too much stress. The other nerve from the brainstem, it's called the spinal accessory nerve. It actually goes to this SCM muscle, which is the most common that is involved in something like torticollis. So I was able to explain to them that the nerves tell the muscles what to do. And if the nerves are under stress, you can stretch the muscle, but it's just going to tighten right back up. The good news with even this baby's first adjustment, they noticed that he started to turn his head more freely side to side. And he went to his PT right afterwards, and PT said, whoa, he's actually moving and making better progress than I expected, because we're affecting the nervous system, not just the muscle. So if this is something that resonates with you, if you know your baby already has a diagnosis of torticollis, or maybe you're wondering, do they have that diagnosis? Maybe you notice their head is always tilted to one side. Maybe they don't like their car seat, or they nurse easier on one side than another. Whenever they're sleeping, they favor one side. They don't like tummy time, or you move their neck and you start to see their body tense and become rigid. If those are some of the things you notice with your baby, that would be a great opportunity to learn more. I know in this mom's case, she actually watched the torticollis webinar that I have done, so I'll put a link to that below. And if you want to understand more about the nervous system and what could be causing your baby's torticollis, and most importantly, what you could do to not wait 6 months to see them get better, but that get them on the path to healing and health and all the development and milestones that they should be going through early on, and putting more ease in their body early on, please check out that webinar. It's free. You don't have to register. It's there for your information. If it resonates, reach out, and we're happy to help. I'll see you soon.